Between C5 and C6, we can see that the disc that is supposed to be here, it's dry. It's a degenerative disc. It doesn't look like the discs above, that they have this white for water. So we have two degenerated discs between C5, C6 and C6, C7. This causes for the disc to spill outside of the back here, as we can see where the arrow is going, and also for spurs, bone spurs to form here, which they obliterate the lateral aspect of the canal here on the right, and they compress the spinal cord, which is this gray image we've been seeing there. We tried medical management with this patient. It worked for 5 years. At the back here, as we can see, as has been drawn, we have a formation of spurs along with the disc herniating at the back here, which causes the canal to stenose and measure only 9 millimeters, which is unacceptable because minimum we would have 12 millimeters of diameter in the spinal canal. So this will cause a compression on the spinal cord, or laterally left and right, as in the case of this patient. She has a pinched nerve because of the small amount of space that is here. The other thing we look at here is that the curve in the spine has been lost. It has been lost because here it's basically bone spurs that have been fusing the spine together. So the spinal canal is from here in the front to here at the back, as we can see with the blue line. And here, of course, there is a defect in it because there are spurs and herniated discs that have been affecting that region. So that's the Adam's apple here, and the incision is in that crease just before on the anterior neck region. So it's going to be an incision approximately about an inch, about 2.5 to 3 centimeters, where that exactly where the crease is. So it's going to be hidden after surgery is done. When the patient heals, nothing will be seen. Okay, so first we access the skin, then we open up the platysmal muscle, and then we go separating the deeper structures, where you go identifying the carotid artery and big venous vessels, which you go pulling to one side, along with the sternocleidomastoid muscle. And in the other aspect in front of the finger, you go feeling the windpipe with the food pipe, which is the trachea and the esophagus. This is the C5-C6 interdiscal space. Here, because there is pressure, we have incited the annulus fibrosus and it's pushing out forward. He takes a biopsy forceps, with the biopsy forceps pulling out the annulus fibrosus, and if there's any of the dry nucleus pulposus, we're going to pull it out too. So basically you're going to clean up the space that is there. This is at the C5, C6 level. And now we're going to put a curette in there to clean up, take out the cartilage that is against the bone. This is basically a disc that we have in the tip of the suction tip. Okay, with the Currison Ranger, we're going to continue advancing. So I give this to my nurse.
Yeah, but I don't
Okay. So we're going to clean the interdiscal space between C5 and C6 with a fine curette, scraping off whatever additional cartilage we find on the bottom of C5 and on the top of the vertebral body of C6. This procedure will be repeated at the level of C6, C7.
La luz se me fue del campo.
C5, C6, C6, C7. That's C5, C6. And down there is C6, C7.
Así le dicen a hacer. Antes no me enseñaste a olvidar. Tú no lo puedes olvidar. ¿Qué será?
If you look at it, it's about 2 millimeters. Yeah, it's about 2 millimeters under the surface between the two bones. And now we have to adjust this one. The same token. Right. So that has to go also under, like the one above.
¿Qué hora es? ¿Qué tiempo llevamos? ¿3 horas?
No,
12.
No, no vi lo que sucedió. A mí parece que hice una cosa. Ya. Dale. Dame. No, me queda con